and its role in the diagnosis and monitoring of IBD. So, Calprotectin is a calcium-binding protein. It is produced in the neutrophils and it is released during intestinal inflammation in the lumen of the body, and it is afterwards it is excreted in the feces or in the stool. You can measure calprotectin by immunoassays, and it is performed with a forward feces extraction. Calprotectin, like I said, it is elevated in irritable bowel disease. It's also elevated in colon carcinoma or bacterial infections of the lumen. And you can use it as a pre-endoscopic test. Well, the calprotectin, you can make a difference between the irritable bowel syndrome or the spastic colon assay or the inflammatory bowel disease. The difference between them is that calprotectin in the IBS is not elevated, and in the IBD it is elevated. And it is a test which you can perform easily, and it is also a proper test, and it is also a valuable test because in the northern part of Europe the incidence of IBD is much high. The IBD in the Netherlands is 35,000 people, and the prevalence of IBS, for instance, is 2 million. And it is a little bit more in men than in women. So what complaints do you have? You have also different complaints in the irritable bowel disease and in the spastic colon disease. In IBD you have mostly diarrhea, blood loss, and sometimes it is very frequent that you have to go to the toilet. In the IBS section you have nausea, and mostly you have constipation. That's a big difference between those two. And recently you have also infections and severe tensions, and in the Netherlands we use also the Salk criteria. Like I said, the calprotectin use of the test results is to confirm IBS. Then you have a calprotectin result which is negative. It is easy for the patient that nothing is wrong. Or you can screen on IBD, and then you have a calprotectin assay that is positive, and it is just a positive result that you know what you have. So when you have a positive test, you can go to the gastroenterologist for performing an endoscopy. Well, how is the test performed? The calprotectin laboratory analysis, when we use the SENTiFIT system, you can use the CALiaGold Pierce tubes with the accompanying reagent kit. And we measure on the SENTiFIT analyzer, and the method which used the principle is a PATIA, a particle-enhanced terminometric assay. The measuring range of the test is till 2200. Maybe it's not that high, but when you can also dilute the test, or you can say, well, high is high, so in our center we does not dilute the sample anymore, because we have tested mostly for diagnosis or sometimes for monitoring, but even when it is higher than 2200, the doctor knows enough. For the evaluation and the validation studies, we looked at the reproducibility. When we started in 2019, we used the common CALiaGold Pierce tubes with a reference number in the 9000 series, and later on, as from 2021, there is a new type of Pierce tubes which you can keep not in the fridge but at room temperature, and that is the tubes with the series 1000. When we looked at the reproducibility within the tube, you can see in the old, oh, I can point it out here. We see that we have different concentrations. You can see that we have a percentage of variation within 6%, which is quite good. And between the tubes, we have, when we sample, so more times, when you can see it here over in the second row, I must see here it is lower than the 10%, which is good for an assay like Calprotectin. The day-to-day variation we also checked for 20 days. In the control sample materials, we also had a percentage of variation of about 5%. With the new test, which is shown at the right side, we checked also at different levels for the within tube variation and the between tube variation. The within tube is even better and the between tube is more or less the same, and the day-to-day variation is also the same. Thus the new tubes and the old tubes are quite comparable. Then we looked at the stability of the tubes and the stability of the stool, and we performed then 10 repeated freeze-thaw cycles of the fecal samples. Then we measured a duplicate fecal sample and extracted that in duplicate, and the sampling was performed by one technician, and the measurement was performed a day of extraction. What we see here is the different levels. Oh, one back. What we see here is the days that we have measured, and then we have here the concentrations of 25, 100 and a high level range. And what we see here is the concentration levels in the different free-thaw sessions. And there's one concentration which is a little bit elevated, but when we lose that, we have still percentages of variations within 10%. We didn't repeat that with the new tubes or with the stool, so we continue with the stability of the tubes, keeping them before sampling at different temperatures. So you can leave the tubes in the fridge. Like the old session, we can keep these tubes at the fridge, which is recommended, but when you keep the tubes at room temperature, then you see what will happen then with a low concentration and a high concentration. Then you see that between when kept in the fridge, you have percentages within 10%, but when you upgrade the temperature, then you see that you have a loss in calprotectin concentration of about 30% when you keep the tube before sampling at the room temperature. So that's not quite well. In 2021, Sentinel launched a new tube, like I said before, the 1000 CSE, and then we did the test again. And what we see then is that when we keep the tubes in the fridge, we have a comparable result. But when keeping the tube like it is recommended at room temperature, even when it is higher in the summer till 28 degrees or 35 degrees, we still have good results, which is only leveling down for about 2 till 4%. So we are very happy with the tubes which we can keep before sampling at room temperature, and even in the summer when the temperatures are sometimes higher, or in the southern part of Europe they may be maybe 28 degrees. So the preservation of the stability of the new CALiaGold pierce tube has been much improved, and I think that is very well. We also looked at the stability of the calprotectin after sampling. Some results are demonstrated over here. In 2020, we have the calprotectin pierce tubes tested after sampling, and we performed the test during several days. And also in the new with the new tubes, we also measured for some days after sampling. We sampled the tube, and then we extracted them, and then we leave the tubes standing at the different temperatures. As the tubes from 2022 must be kept in the fridge, we only test it in the fridge. And what we see over here, that you can keep the tubes, and that you have to measure between 5 days, otherwise the results are getting higher and higher. What we see over here with the new tubes, you can see over here, even kijken, where is my pointer? When kept at a fridge, you have very good results. When kept at room temperature after day 11, they will lowering down. And when you keep the tubes at 28 degrees, you can measure till 4 days. So in our situation, we have said, well, we do not change the protocol after sampling. We keep the tubes in the fridge. But when a patient send the tube back to the laboratory, and it is within 2 days, and it was at room temperature, we say we can collect the tube, and patients does not have to recollect a sample tube. So also the conservation of the stability has been much improved. And we say that, well, we can keep the tubes before measurements in a reasonable time of 2 weeks. But normally we measure 2 times a week, so it is quite well. And even if a tube is kept at room temperature, we can measure all the time. Then we have some comparison studies performed. Firstly, we did a regression study with the FADIA system, because that was the system we used before the introduction of the SENTiFIT analyzer. You see the results in the left side of the screen. I will demonstrate them. What we see over here is that mainly in the part, and that you see here in the middle, is from a concentration of 500, over 500, the difference between the FADIA method and the CALiaGold method is becoming bigger. The CALiaGold measures higher than the FADIA method. It is because of the kind of extraction chassis. That is why it is getting higher. And what you see over here is that we tested 46 samples, and then we looked at the performance, and then we said, well, 9 samples were in an inconclusive range. That we said, well, the FADIA was negative, and 9 samples were in the inconclusive range of maybe it is a little bit elevated, but not negative. That was the difference between the FADIA method and the old tubes. Later on, we have tested again with the new tubes. We were not able to measure and to compare with the FADIA method, because we don't use it anymore. So secondly, when the introduction of the new CALiaGold method, we have tested them with the former tubes. And what we see over here is that there is not much difference between the old method and the new method. What we see here is a comparison of 0.93 and a slope of 0.92 with an intercept of 27, a bias of 27. So the new tubes measure a little bit higher. But what we also see from the last slide is that maybe we have to check for the cutoff values of the Calprotectin assay, which must be maybe a little bit higher, or also the cutoff values for measuring or for performing an endoscopy must be elevated, because we all use the endoscopic values from literature, from all methods again. So maybe it's time to also to start a study for the reference values and the methods for performing an endoscopy, which is now we are performing, and the results are expected in June. And what we see is that the reference value will be a little bit up-leveled, and also the endoscopic cutoff value will be a little bit higher, we guess. In summary, the advantages of the Sentinel CALiaGold purse tube is that the new tubes, the preservation of the stability is improved. It is user-friendly for fecal sampling by patients at home. We can keep the tubes 4 weeks at room temperature at least prior to fecal sampling, and we can keep the tubes in the fridge till the expiry date. Also, after sampling, the conservation of the stability is improved in the new version of the tubes, and we can keep the tubes for 14 days in the storage or 4 days at room temperature before measurements in the laboratory. So, as a whole, the analytical performance of the new CALiaGold assay is quite good, and it meets the requirements of the quantitative determination of the calprotectin in human stool. At last, I will tell you something about the home sampling procedure, which is introduced during COVID times in our laboratory. Well, there are some amounts for, are we performing fecal centrum, or must it be always by a lab technician in the laboratory? Our decision to change to the SENTiFIT system and the home sampling procedure was that we have many tests per year, 150 per week, so it is time consuming to perform an extraction hand by hand with, for instance, the VADIA method, and when it is performed sampling by a lab technician and then extraction on the vortex, it's only 2 minutes per tube, but with the VADIA method, we are all as a whole, we are using 45 minutes, so it's quite time consuming. We also say, well, the analytical performance we have checked, it is okay. And in March 2020, we said, well, we have to perform before we could go over to the home sampling procedure to the to a study which measures lab performance, stool sampling by lab personnel and stool sampling by a patient at home, and look at the difference between the two results. Well, COVID has some other plans, and we, as the WHO recommended to stop all fecal sampling at the first part of the COVID part. Then we said, well, we do not perform any feces tested, also including the FIT test for the FOB or the Calprotectin test. Then we said, well, we stop, we cannot do that anymore. But after a month, the internal medicine doctor said, well, help us. Can we go again? Because we must perform all endoscopies, and we do not have the time for that. So we thought, well, we must something. We have a new innovative system, which is a closed system, and it's also very fine. Only for not only for lab personnel, but also for patients at home. They can sample at home. And we had the approval of the clinical doctors who said, well, go with the system, and we will see what it will do without the study, with the comparison of keeping the sample from the lab technician or by the patient. So we moved directly on to the fecal sampling at home. And we said, well, we will do that in a later phase. So we said, well, when we perform the test at home, the stool sampling, it must be in a very controlled manner. So we put on some instructions with a clear instruction folder, how to fix it to sample at home, with very clear with images, which is also very friendly. And then we said, well, the tubes, you get a tube, you must keep the tube in the fridge at home, and when you sample, you can put on the tube, you must sample, and you must bring the sample tube within 24 hours to a regional service point or back to the laboratory. And then we have all tubes back within 24 hours. So it was a very controlled system and return deliverance because of the analytical assay which I demonstrated to you before. You must be in a very controlled manner. With the new CALiaGold Pierce tubes, we started not in January but beginning February 2022. We had a new home system for sampling that we can keep the tubes at room temperature. So we changed a little bit the instructions that we give the tubes with the patients and say, well, you can keep the tube at room temperature, not with your eating in the fridge. So it is easier for them, and it is a little bit cleaner in the mind. But the after sampling procedure we kept the same because we said, well, we want to have the tubes within 24 hours or maximum 48 hours back to the hospital because we want to measure them 2 times a week and not keep them so long without sampling, just for the reduction of the calprotectin in the tube. After a long period of sampling, we said, well, how it is going? Do we need to perform the test by sampling at home or just by the patient? We had decided not to perform the comparison study anymore. We see that 2% of the samples is incorrect, and the meaning that there is too much stool into the tube. Sometimes I don't know how they can do it, but there is no buffer in the tube, or the tube is opened at the other side. And I think that is quite a successful thing because the white part of the tube, it is sticked with glue or something, so you need extra material to open it from that point, but sometimes it's so overfilled with stool that it must have been opened, and when we try to open it, we can also open it, so it must be opened. But 2%, I think it is very valuable, and then we report that the sampling procedure was wrong and that we need a new sample. The comparison study of the current and the new CALiaGold Pierce tubes, it's about 5 of the 100 samples that we have negative with the old study, and we have inconclusive results with the new study. So that keeps us in mind that possibly the reference value will be a little bit needed to be up-leveled. Well, that brings me to my last slide. Do we have any questions? Yes. For the liquid samples, yes, it is in that specific case we say perform your features in just a normal sample, and then we sample at the laboratory, and then we pipette 50 microliters directly into the tube. Because it is so watery, so you cannot perform it at home. Oh, it is normally the extraction buffer is just a little bit, how do we say that? A little bit brown. But when it is overfilled, you see the stool completely at the yellow part of the tube, and also it is in the upper part, in the part of the extraction buffer. It is all over the tube. It is easily seen. When the medical doctor says that a calprotectin test must be performed, they can go to our laboratory. But with the new tubes, we have decided that it is also possible that the polyclinic gives directly the tube within the patient. That is also for our laboratory more patient-friendly. So they can, we give them then directly to the patient, and in the general practitioners, we have a regional service that the general practitioner can order 5 tubes, and then every general practitioner has 5 tubes, and they can give them with the patient directly. And when the general practitioner doesn't have it, they can go online and they get 5 new tubes. More questions? No questions. Then I hope that you will have a nice day at the booth or at the Euromed lab or at the scientific presentations. Good day.